Welcome to the What's Happening Birmingham video podcast.
Hello everyone, this is Jarvis S. Scott with What's Happening in Birmingham. Today I am back with Dr. Morgan King of the Traveling Chiro Guru, and we're here to talk about a very popular topic, and actually something that a lot of us do. Well, I'm going to say a lot of us, all of us do pretty much. We tics. But actually, there's something called tics-neck syndrome that Dr. King is going to tell us about and how that can affect your neck. So, Doctor, thank you again.
Thank you for inviting me.
You're welcome. So tell us a little bit more about this, because this was interesting when I came in your office and did the previous segment.
Oh, yes. So I notice a lot of people with their cell phones, and one thing that they don't notice is that the cell phones have a lot of effect on their health. So here we are looking at an x-ray right in here of a person just looking straight ahead. This is how the neck is supposed to look. But however, when we are using our cell phones, a lot of us don't know that we go from a normal position and our head is bent forward like this. So when we bend our head forward, we're looking at certain degrees of how our head is carried forward. And this tells us the amount of weight that our heads generally are. At 0 degrees, our heads are noticed at 12 pounds, but an average head weighs between 10 to 17 pounds. So we're carrying 10 to 17 pounds here. At 15 degrees, that's going to increase to 27 degrees. This is why we experience a lot of our headaches. We have our back pain, especially right here. You're carrying it into the shoulder region. We even damage a lot of the muscles because our muscles are not designed to hold 10 to 17 pounds in a 1 to 2 inch forward posture, which would make it between 27 pounds to 40 pounds. Eventually, over time, we're going to wear down a lot of these joints because they're not able to move that way. And I have had a lot of people, 18 and 20s, come in and they're experiencing the onset early arthritis. So that is not a good thing. We're going to look at this picture that's going to be right here, and this is what we're going to describe with the phases of degeneration. So during a report of findings with all of my patients, we go over how the body actually works. So this is how your spine looks in your entire body. You have quite a few areas. You have the cervical spine right here, 7 bones in the neck. Thoracic has 12 bones in the neck. Lumbar is 5, and then you also have your sacrum here. So when you move your head forward, you're going to be putting yourself with the early degeneration starting in this phase. This is how normal is supposed to look right here, backward C shape. Eventually, when the muscles in the back cannot sit there and take control of your head with it being forward and the muscles in the front really just aren't working well, you will lose the curve in your neck. The discs sit right here in the black spots. X-ray is going to be black. MRI, depending on which field you have, will show either black or white. We don't want these spaces right here to slowly decrease. 10 years or so down the line, we're going into phase 2. Phase 2, you will notice that these spaces are going to close off. We're going to eventually start getting bony protrusions there. We're going to lose our nice box-shaped vertebral bodies. These are going to start to show off white here. 10 years later down the road again, here we are. These bones right here are going to fuse together and become one segment. When you are in these phases right here, chiropractic can help. But as soon as these start to phase off, that is when you're going to need an orthopedic doctor, and they may have to perform surgical intervention in order to help you with the decreased headaches, neck pain, and even when the pain starts in your neck and goes down into your shoulders and in your hands. So we don't want that to happen. So that's what I'm here for with Traveling Chiro Guru. I'm here to assist you with your tics-neck syndrome, so that way we don't have to experience that. You can reach me at 205-949-7650 or follow me on Facebook, so that way we can show you exercises in order to assist you with that syndrome.
But you're also on Twitter and Instagram as well.
I am also on Twitter and Instagram as well.
All right, so as you was describing these graphics, can you dispel the myth that this doesn't happen to older people, it happens to people of all ages?
It is a myth. I have had patients in their 70s and 80s with better spines than my patients in their early adult ages, such as their 20s and 30s.
All right, so most people that you come in your office, which phase are they in? This 1, 2, or 3?
It all varies. Like the patient I had yesterday, she was in phase 2 and she was 23 years old. I have even had patients in their 40s with they're just straight neck, and it's like, all right, it's time to do a lot more exercise, and then it's time to get these bones moving better, so you're going to have to see a chiropractor. And that is another myth. A lot of people think that once you go to the chiropractor, you're going to have to continue to come see us, and that is not true. So once you come see us and we get your bones moving, we get everything moving like it should, you will just come in, and it's mainly for a checkup, just like you would go to a dentist.
So final question,
Yes.
I try to quiz you, is that at what point, because a lot of people out here they use pain medicines,
Right.
at what point should we stop using the pain medicine and come in and see a chiropractor?
Well, we kind of generally don't like the pain medication field. You can take it if you need to, but we prefer for you to come see us. You can even take it and you'll gradually, slowly start to decrease the amount that you would need once you see us, because your spine has a lot of jobs and duties, and that is to get some of your organ systems here to start functioning correctly, where you don't need the pain system. So once your body is in place, the bones are in place, everything's moving correctly, you won't need it.
All right, and I guess this just came on my head too. Sleeping,
Yes,
and how does that affect the back?
sleeping does affect the back.
Okay.
The best positions to sleep in are going to be on your side, or it's going to be on your back. When you sleep on your stomach, and I've been guilty of doing that myself, what we do is we increase the pressure in our lower back, and this is what's going to increase our low back pain, because our body was not designed to hold itself up in place. We need extra support here, and that's how our beds are generally made, for us to either sleep on the side or sleep on our backs. And they even design pillows specifically for that. I have had patients where sleeping was the one thing that did increase their back pain, so we had to change positions on them, get them different types of pillows in order to support their head better. Sometimes you would even need a pillow in between your legs in order to help keep your spine aligned.
All right, so I guess when people's thinking about that, then how often should I change my mattress?
Generally, the mattress people tell you that you have to change it every 10 years or so, but I have had personal experience where I've had to change mine just a little bit quicker, because when we do sleep on there, we do shed skin cells and we do sweat a little bit, so that degenerates our mattresses just a little bit faster. And some of us are even guilty of sitting in our beds and watching TV, which also makes our mattresses not as effective as they need to be. So generally, I have had mine changed every 5 years or so, because I like the support of having a newer mattress keep me afloat. I don't like mattresses too soft, because then you sink in and you don't have the support as well.
All right, so if they want to contact you again, the phone number and social media?
Okay, you can reach me at 205-949-7650, and you can also follow me on Facebook, Twitter, and Instagram.
All right, well, Dr. King, thank you again for coming on for bonus segment. But when I came to your office today, when I saw these signs and graphics, I was like, we got to talk about this in an additional segment. So thank you again, you all. Please come and see her. Matter of fact, she'll come to you. So you got no excuses. So thank you all again. Have a great day. Please check out what'shappeningbirmingham.com for more videos. And don't forget to subscribe to my YouTube channel. Thanks again. Bye-bye.
Thank you for watching the What's Happening Birmingham video podcast. Please check out our website, app, or subscribe to our YouTube channel for the latest videos today.